Well, basically, yes. It will depend on the disease the patient is suffering from. In children, the indications are very limited because children with chronic rhinosinusitis are rare. So in children, I would rather recommend to check the nasopharynx for adenoids and then apply medical treatment such as topical steroids. And in case the situation gets worse, then we can discuss whether there is or not an indication for limited surgery. I wouldn't make the age limit for itself. I think the indication usually particularly in chronic inflammatory disease is something you have to discuss with the patient. So as I always say, we do not do surgery on CTs. It is the patient who has to come forward and almost ask us for a revision or for first a primary surgery depending on his or her symptoms. So what we do is we treat the patients medically, and if there is no good response or the symptoms are persisting, then it's usually the discussion with the patient which comes up to indicate then the endoscopic or endonasal surgery. That can be very difficult. You may have, for example, patients with typical rhinologic or sinusitis symptoms who on the CT doesn't show almost anything. And then you can have the suspicion that there is air entrapment, for example, or that they have a type of barotraumatic rhinosinusitis, which cures usually with topical treatment alone. There are also chronic rhinosinusitis with less symptoms, where sure you can have complaints, we can have abnormal findings in the CAT scan, but who, for example, have no polyposis, have little alteration of their daily life and burden, and then you not necessarily need to do surgery, but keep the patients on chronic medical treatment.